Sorry about that. I had a technical difficulty. So I'm going to continue along the lines we were talking about. I mentioned that you might have already tried medications, injections, or even been told that surgery is your only option. When you're looking at those kind of things, that's overwhelming. And the side effects of that in themselves are tough, but it can also mean downtime. And sometimes the results are only temporary. So that's why I'm so passionate about sharing spinal decompression therapy with you, because it offers something different from those things. What spinal decompression is, I'm going to explain in simple terms. Spinal decompression is a gentle, non-surgical treatment that helps your discs heal naturally. In our office, we use a system called the KDT NeuroFlex table. It's one of the most advanced decompression systems available. Here's how it works. The table gently stretches and releases your spine in a very controlled way. This creates negative pressure inside your discs, kind of like a vacuum effect. That pulls herniated or bulging disc material back toward the center of the disc and draws in fluids and nutrients your discs desperately need to heal and repair. Over time, this takes pressure off the nerves, reduces inflammation, and ultimately allows your spinal discs to heal and repair. Here's the part patients love. It's actually comfortable. Many people actually relax so much during the session that they fall asleep. No shots, no surgery, no scary procedures. Just a gentle, precise therapy that works with your body. Now, if you're wondering who all can benefit from spinal decompression, we've seen spinal decompression make differences for people with herniated or bulging discs, degenerative disc disease, sciatica or nerve compression, spinal stenosis, radiating arm or leg pain, chronic neck or low back pain that hadn't responded to other treatments, and more. We've even had patients in here who have been told their only solution is surgery. One of our greatest joys is finding out that we can help somebody avoid surgery. So if you've tried just about everything else, medications, injections, endless physical therapy, and you're still in pain, decompression might be the answer that you're looking for. Now, the reason that it's actually better than depending on something like surgery or injections, those are some of the common options people rely on when they're suffering from problems like we're talking about. Well, number one, surgery, sometimes it's necessary, yes, but it's invasive, and it comes with risks like infection and failed surgery syndrome, and it requires long recovery times. And the other problem is, once it's done, what's been done is done, and you can't go back to where you were before the surgery. Failed back surgery syndrome, they say can be as high as 50%, so it's something to consider before you have surgery done. Another approach has been spinal injections and radiofrequency ablations. These offer temporary relief, but they don't fix the problem, and that's the problem with these. They just cover up the problem for a while. If you're not familiar with a radiofrequency ablation, they actually go in and cut the nerve into the disc, but eventually the nerve heals back, and then the problem's still there. In fact, it's gotten worse, so the symptoms remain. And then there's medications. At the very best, they can take the edge off. At the worst, they can become habit-forming or be tough on the rest of your body. Spinal decompression, on the other hand, is safe, comfortable, and non-invasive. There's no downtime. All right, you literally walk in, get your treatment, and you walk out. But most importantly, it's aimed at fixing the root cause, the damaged disc and compressed nerve, not just masking the symptoms. That's why I get so excited about this treatment. It's helping people get back to living their lives again. Now, if what I shared today sounds like the kind of relief you're searching for, I want to make it easy for you to take the first step. We're offering a very special offer for our new patients. For just $49, you can come in, receive a complete initial examination. We'll review any existing x-rays or MRIs that you've already had taken, as long as they've been taken within the last year. And you'll also receive your very first spinal decompression treatment. We'll do all that for just $49. That's everything you need to find out if the therapy can help you at a fraction of our normal cost. So I don't want cost or fear to stand in the way if you finally get the relief you deserve. Now, I want to share with you a couple of quick stories. I want to talk about a couple of patients who have come in and who have already tried spinal decompression and gotten great results. One of our patients who came in, he owns a number of gas stations. He had been a patient here previously doing chiropractic care. He lifted something too heavy in his gas station and herniated a disc. As a result, went to see a spinal surgeon. A spinal surgeon recommended surgery, but said one thing that might possibly help would be to try spinal decompression therapy. So he came back in to ask us if we knew anybody who did spinal decompression therapy, not realizing we did. We started a course of care with this gentleman. He brought an MRI in that showed his disc pressing his spinal cord back up against the back of the canal where the spinal cord runs. We worked with him for approximately 3 months. At the end of his course of care, not only had his leg pain completely resolved as well as his back pain, but the follow-up MRI that was done showed that disc had returned to its normal position. Absolutely remarkable results. And we just completed his care a couple of months ago. Another patient we took care of is a woman in her 50s. She came in complaining of she'd had long-term neck pain, but was having numbness and tingling and pain radiating down her left arm. It had become a bigger and bigger problem for her and wanted to know if we could help. We started doing spinal decompression therapy with her. After just a couple of treatments, the pain went away. So she is still under care for that as we make sure that it's fully healed. But she's already gotten rid of the pain she came in here for. And that's just 2 of the stories of patients that have received care here. I share these stories with you because if you're one of the people out there who feels like you're in a seemingly hopeless situation, if you're looking at the possibility of surgery but scared because of the downtime, because of the possible side effects, because of the fact that so often one surgery leads to another and you want to find another answer, if you've already feel like you've tried everything, but if you hadn't tried spinal decompression therapy, this may be just the answer that you're looking for. And I want to help. So, again, we have a special for new patients that we're offering right now, that if you'll call our office, 512-345-9355, mention spinal decompression therapy. They'll schedule you for your initial examination where we'll do an exam, review your existing MRIs or x-rays, and your very first spinal decompression treatment will be rendered to let us find out if spinal decompression might be the solution you're looking for. I want to encourage you, if you're looking at some of those other solutions, don't let this opportunity get by at this reduced rate. Does that make sense? Now, I want to thank you for joining us today. I hope you'll take advantage of this. I look forward to helping those of you who have further questions. And if you have further questions and want to talk to me further, you can call our office, and I'm happy to call you back and discuss it with you further. But next month, we're going to be doing a special presentation. Dr. Mary is going to talk about your biological clock. All right, and what she's going to talk about is how to understand it better and how to influence your biological clock. So be sure and tune in on October the 15th at 2 o'clock and catch her providing that special information. But until that time, this is Dr. Tom Neblett with Austin Disc and Spine at 4 Points Family Chiropractic, where we offer non-surgical disc repair through spinal decompression therapy. Thanks for joining us today.